Ready. Okay. Welcome, everyone. I'm Lamecca Holmes, Director of the East Flatbush Community Partnership. Thank you so much for joining us for our monthly meeting for the month of May. We are grateful that you are here with us. It's going to share today's agenda. We're going to start with our East Flatbush Community Partnership updates and events past and upcoming. And we have 3 presentations lined up for you all today. We have Jessica from the Daycare Council of New York. We have Gabrielle from the Child Development Support Corporation. And we also have Karen from New York City Department of Health and Mental Hygiene. We're going to have our program updates and then closing remarks. Kai is going to lead us in our East Flatbush Community Partnership update segment.
Good morning, everybody. My name is Kai Priere, and I'm the Community Ambassador at East Flatbush Community Partnership. Our weekly newsletter send any events and flyers to readc@jccany.org and for access to our monthly meeting presenter form to present at our next meeting. Our upcoming monthly meetings in June, which is next month, it will be hybrid, which means we're in person and over on Zoom. The address is 57 Willoughby Street. If you're willing to come inside, which we hope you do, so we can see all you guys' wonderful faces. July and August will be virtual, and September and forward will be hybrid. The East Flatbush Community Partnership invites you to join us as our community resident liaison. It is a dynamic role that empowers you to play a vital part in community engagement activities. Your role as a community resident liaison will consist of attending leadership and general meetings, actively participating in decision-making activities, sharing valuable feedback with your fellow residents about the wealth of community resources available, and cultivating a strong connection to the community. You'll receive leadership development, some networking opportunities, and a $250 stipend every 3 months for participating. Our virtual open door is every second Thursday of each month at 7 p.m. It is a monthly virtual resource fair for East Flatbush residents to share information and access resources for families and communities to thrive. We also have the raffle prizes that we give out during our meeting too. Thank you. Our community aid initiative. This is in response to the ongoing financial challenges in our community. What we're offering is financial assistance, specifically for utility bills, referral services, for any additional assistance. How to apply, you can complete our request aid form and email past due utility bills at efcpsupport@jccany.org. For any questions, please call them up. Thank you. And our wonderful website that we always bring up, eastflatbushpartnership.org. Please check it out to find out all of our information and anything that we have going on. Thank you.
Thanks, Kai.
Hello, everyone. Cindy Reed here to present past events. So with the partnership, we hosted our annual Men's Street Appreciation on April 27th in Bed-Stuy. Various partners on board with that one, as you see at the bottom. It was a grand time, giving out men's clothing, gift cards, free haircuts, health screenings, and all, just showing our men in the community appreciation. And we look forward to hosting our second one coming up soon too. Here's some pictures from the day. Michael, we didn't get good pictures of the crowd when I look back on the pictures. Sorry. Navigating, we also, in partnership with, sorry, the program's escaping me. I apologize. And the screen's too slow for me to read. But anyway, Pastor Gil Monroe's hosted, facilitated workshop on navigating your local government. on, what was that? May 8th. We weren't able to participate because we weren't available, but I'm sure that it was a good workshop, and I hope that if anyone's on the call was able to participate. I know I shared it with a couple of our partners that were interested in it. Life of Hope hosted their Haitian Culture Day on May 11th. It was a great opportunity for us to table and share resources with the community. And we hosted our annual Women's Summit on May 18th. That was a grand time as well, with workshops. We always ended with a nice all-female panel. And give the screen is blank for me. You see something, Lameka?
Yes, we have up pictures of our presenters.
Okay.
Yeah.
So we had our keynotes. Yeah, I see it now. Thank you, Lameka.
Mm-hmm.
Sorry, I got kicked out. Can everyone hear me?
Yes, we can hear you.
Okay. I don't know if you heard what when I said our keynote speaker was Assemblywoman Monique Chandler Waterman. Sorry. We also had Nadira John provide a mental health workshop, and Marie Simon provide a financial workshop. And these are the three women that you see here. And these are some pictures from the day as well. We participated on May 11th at Winthrop Beacon, tabling to share resources for their Spring into Health event. And Health First hosted a Haitian Flag Day celebration on May 17th. I wasn't able to table because I had an emergency, but I know that it was a grand time, and we're happy that we were invited to be there and look forward to being part of it next year, because they do it every year. Like, the screen is blank to me. Do you see something?
It's upcoming events.
Okay. So, like I said, we are continuing our annual Street Appreciation, a Day for Our Kings on June 1st, hosted in East Flatbush at Hillel Plaza between 11 a.m. and 3 p.m. If you'd like to come and table, we're welcome you to come and join us. I'm sure it's going to be a grand time like it was April 27th in Bed-Stuy.
And then there's also the farmers market flyer up, Cindy.
Thank you. And we are in collaboration with Seeds in the Middle, the new East Flatbush Family Enrichment Center, and the Flatbush YMCA, hosting a farmers market on Fridays. The time has changed from 2 p.m. to 5 p.m. This Friday, we will have the first 20 people can receive a $5 coupon to start their cart. So we look forward to seeing anyone that would like to participate in that on this Friday. And we are thankful for our council member, Farrah Lewis, who has provided that funding to Seeds in the Middle to fund this initiative.
Thank you. Edlin? I think we may have lost Edlin.
Oh, I'm
Okay.
right here.
Oh, you're here. Okay.
Oh, yeah.
Your slide.
I thought I was dying. Hello, everyone. My name is Adelina. I'm from the East Flatbush Community Partnership. So just in the chat, if you can, for residents, please type your name, email address, and the word resident in the chat. And if you are a service provider as well, please type your name, your email and address, and organization that you're representing as well in the chat. Okay.
Okay, and you can introduce our speaker.
Yes. So we will be starting with our first presenter, Jessica, I don't want to mispronounce your last name, Loriano, from the Senior Child Care. She's a Senior Child Care Specialist at the Daycare Council of New York. So you could take the lead, Jessica.
Thank you. Should I share my screen or do you have
Yes,
the?
I'm gonna allow you to be co-host. You can share your screen. One moment.
No problem. So I can chat in the beginning. So my name is Jessica Laureano. That's the American way of saying it, Laureano in Spanish. And I am from the Daycare Council of New York. We service all 5 boroughs of New York City for parents that are looking for childcare services. We also do some other things that I'll go into a little bit more later. So I'm going to go ahead and share my screen. Okay. I'm not good at this, but open. Okay.
I think if you go to slide, maybe, or you got it? Okay,
I think so. I think so. There we go. That's fine if you see the little thing in it. So, like I said, my name is Jessica Laureano. I am the Senior Child Care Specialist at the Daycare Council of New York. And this is our team. Rebecca Felipe is the Community Engagement Specialist. Jessica Laureano, which is myself. I am the Senior Child Care Specialist. Then we have Ingrid Marin, who is a Child Care Specialist, and then Sophia Lopez, who is the Child Care Division Director. So how can we help? That's me right there with the mask on. So we offer free consultations and referrals for family looking for childcare near their home, job, or school. We are funded by the Office of Children and Family Services to provide childcare resource and referral services in all 5 boroughs of New York City. Now, with that being said, if you live outside of New York City, don't worry, we can give you the numbers to those CCRNRs to assist with you. So not all is lost. If you live in like Westchester or like Mount Vernon or somewhere like that, we can give you the appropriate phone numbers to call and they would be able to assist you. So Daycare Council services for families. Let me move this because, yes, okay. So we provide referrals for your family to support you in making the appropriate choices for your children from birth through school age. Usually that starts around 6 weeks because that's when you usually get like a birth certificate and social security card for your child. So that's when we're able, and most providers are licensed from 6 weeks old. So yes, childcare counselors assist parents with questions related to how to find childcare and how to apply for childcare assistance. And families can get in touch with a counselor during our office hours, which are 9 to 5, Monday through Friday. Our phone number is 212-206-7818. My extension is 2110. Ingrid's extension is 2121. This is the website, and it would be like just an open, and they're just ask questions like name, phone number, addresses. We would, if you go into this DCCNY website, it'll direct to one of the counselors and we would call you with follow-up questions just so that we can get like the appropriate age of the child, exactly the address where you want for us to help you locate childcare. So we just fine tune it afterwards with a phone call just to follow up. This is a big one, paying for childcare. With childcare assistance, you can access childcare at centers or in provider homes that meet your family's work schedule. You can also find childcare for children as young as 6 weeks old. Under the new guidelines, you may be eligible for free or low-cost childcare based on your family's income and reason for requiring childcare. Effective 2024, the new income guidelines for childcare eligibility are For a family of one, you have to make less than 51,000. For a family of two, 67, 3, 83, 499, and so on. This is 300% of what the poverty level was. It used to be 200% of poverty level. Oh, I'm just ahead of myself. Your family may qualify for child care assistance if your family income falls below 300% of the federal poverty level and you have an approved reason for seeking child care. The reason must be at least one of the following. You work 20 or more hours per week. You are in an educational or vocational training program. You have been looking for work. You live in temporary housing. You are attending services for domestic violence. Eligibility is based on your family size, residency, income, and reason for care. It is verified using the documentation you must submit with your application. Let me make sure. Okay, how to apply for a voucher. ACS is currently accepting applications for child care assistance for families citywide through MyCity. MyCity makes it easy to apply for assistance and track the status of your application. For more information and to apply, visit MyCity and that is the website. If you can't screenshot it or this is kind of a long link, you can just Google MyCity. The first one that comes up, you click on that, and that's how you would access the MyCity as well. I don't know when you do it through Safari, if it's still the first one. I do everything through Google. I do know if you Google it, it's the first one that pops up and you can go from there. Reminder, grants are for providers and not parents. We're going to act like I didn't say that. And that's for, we also help providers who already have licenses obtain certain grants and their qualifications to continue to provide services for children. So the types of child care assistance. Child care voucher. A child care voucher will help you cover most or all of the costs of child care at a qualified provider of your choice. Vouchers can be used at hundreds of center-based and home-based providers across the city. They may also be used to pay approved relatives, neighbors, or friends for childcare. Vouchers can help pay for childcare year-round for up to 24 hours a day. If you are determined eligible for childcare assistance and select this option, you will receive a voucher that you can complete with the childcare provider you pick. After your child is enrolled with the provider, the Administration for Children's Services will pay the provider directly each month. For more information about vouchers, visit the website here. And this tool can help you locate childcare programs in your community. Or you can just call me and I can help you locate childcare providers in your community. Easier. Contracted care. The Department of Education provides a number of free or low-cost childcare programs for families that qualify. These programs provide early care and education from children from 6 weeks to 5 years old in center-based homes or school-based settings, or year-round for up to 10 hours a day. Eligibility is based on your family's income and needs. If you qualify and there is a seat available, your child can begin the program anytime during the year. If your first choice program does not have space, DOE will help you find other options. And you could use the My Schools map to learn more about programs in your neighborhood. Head Start program. Early Head Start and Head Start programs are free, high-quality early childhood education programs that support the whole family. Programs run for at least 8 hours per day and offer a safe, positive learning environment for children to learn, play, and build the skills that get them ready for kindergarten and beyond. Early Head Start provides care for toddlers 2 years old, and Head Start serves for 3- and 4-year-old children in centers. The best way to find out if your family is eligible for Head Start is to contact a program directly. Okay, so I'm going to go back here. I do know the eligibility for Head Start programs, the amount you can make is significantly lower than it is for like the voucher. For an example, for a family size of, I want to say 2, you would have to make less than 18,000, whereas the voucher, it is 50 something thousand for a family of 2. Non-traditional care or legally exempt childcare, generally referred to as care offered before 7 a.m. or after 7 p.m. That may also include Saturdays and or Sundays. There are few options in centers, some in regulated family child care and group family child cares. More likely to be a relative or a neighbor. Legally exempt child care. A legally exempt provider is an unlicensed informal child care provider who cares for up to 2 children and receives payment from the Department of Social Services. WEDCO works with both licensed and legally exempt child care providers to ensure safety and nutritional standards are met for children during the most crucial stage of cognitive development. The reason why we put WEDCO on here is because Daycare Council does not deal with unlicensed providers. We only have licensed providers in our database. ACS, informal legally exempt childcare provider enrollment, is how you would get to that. Free community programs. So there's non-traditional cares, which community coach programs. For example, if you would like to find more information about youth and teen programs or discuss programs for your child, please email media.ed@parksnyc.gov or call 212-360-2791. The New York City Parks After School program is for ages 6 to 13 with academic support and physical activity in a safe, structured environment. Free program takes place on weekdays from 3 to 6, a crucial time to engage school-aged children in structured activities and expose them to new interests. Programming is based around monthly themes supported by sports and fitness, arts and culture, and STEAM, which is science, technology, engineering, art, and mathematics. Our program complements what children are learning in school and strengthens their sense of belonging in the community in which they live. And to find that out, you would go to the New York City Parks After School. Resources for asylum seekers. So the resources for asylum seekers is through the American Red Cross. Their address is 520 West 49th Street between 5th and 5th. That doesn't seem right. I will get more information on that, but it is West 49th Street in Manhattan, and their hours are Monday through Friday from 9 to 5. They are closed on weekends and major holidays. To call, it's 1-888-744-7900. You can also contact Catholic Charities, and their number is 888-7, same number, for appointments for the center. Call us for assistance looking for or selecting a child care program. Our counselors are available Monday through Friday between the hours of 9 a.m. and 4:30. We are open from 9 to 5. The reason why we say 4:30 is because when you call us, the call will take about 15 to 20 minutes, and we want to be able to give everyone the appropriate time to get what they need. We don't want to rush them off the phone, so we stop taking calls at 4:30 just to give sufficient time to be able to have a one-on-one conversation with each parent individually. We are located at 1430 Broadway. That's on 40th and Broadway in Manhattan. We are on the 4th floor, Suite 404. Here's our phone number is 212-206-7818. And our fax number is 212-206-7836. So if it's okay, I will open up the floor for any questions that anyone may have. I did kind of run through that a little quickly. So if you have any specific questions, you can go ahead and ask me and I will try my best to answer. How do I stop sharing?
I have a question. Does your office provide any assistance with the application? I've experienced like in the past, sometimes it's a little bit it's a little bit daunting for the parents when they look at all that's required for it.
Yes. So if a parent runs into like, I can't do this, this is very difficult, you can call us and we can set up an appointment time for you to come in. We can assist you with getting the application done. We just remind parents that we don't give the denials or approvals, but we can try our best to assist you in like, what do I need? Like, how many pay stubs do I need and stuff like that? So yes, we do help if it is needed.
And what assistance do you provide in helping the parents find like a daycare or so?
So we use a database, it's called Empire State Child Care. And so we go according to like that. How do I stop sharing? I can't stop sharing. But it's
At
okay.
the bottom, I think it's red. It'll say stop share, but I can just stop making you a co-host. And I think that might
I
do
see
it.
it. It's at the top because I moved everybody up to the top. So I had to move it down. The question was, oh, how do we, okay. So what we do is we ask a series of questions, like age of child, your address, if they have special needs or not, and we compile that into the database. The database will come up and send us a list of, and how close you want it, right? So most of the time what I do is I do within 5-mile radius of the address that they gave me. So it will give me a listing of who's in that 5-mile radius for a child of the age that you just gave me or children. A lot of the times there's, let's say, a baby and then there's a school age. It will also help us to locate someone who would accept the baby and that school age child for after school services. So it's the age of the child, the address that you gave me, and if you want any special needs or situations like that. Also, if you want a center-based or family and group family providers. The next question probably would be, what is center-based and family and group family providers, right? So I'm just going to go ahead and answer them. So a center-based is basically like a school where they move classroom to classroom according to their age. Most center-based start at age 2. And then family and group family providers is someone who has a license to watch children in their homes. Not the parents' home, but the provider's homes. So in East Flatbush, we have a lot of those, right? So it's like someone who has like the daycare center in their homes in the basement a lot of the times, or like on the first level, but the provider does live in that home and they are licensed for children 6 weeks to 12 years old. Yeah. In a family provider's home, they are licensed for 6 children and they can have 2 children under the age of 2. A group family provider is licensed for 12. They have an assistant and they can have 4 children under the age of 2. Now, there are some providers that will have nothing but infants, but just know the ratio is 2 to 1. So 2 infants under the age of 2 per 1 adult.
Karen, do you still have a question?
Yes, hi. There's two questions. One piggybacking on what I think it was Cindy had asked.
Mhm.
There's not like a person or a place or anything. So you submit, our customers submit their papers and never, it's just like, and what? And what, like, they're.
So
what
are you
do
talking
they
about the
do?
voucher wise, or are you talking
Any
about?
childcare assistance paperwork, they start with the paperwork and it'll say that it's submitted, but there's not like, HRA has a place you can go. There is no place you can go as it relates to that. So they're kind of like left in limbo. There's nobody to advocate. We can't reach out on their behalf. Or
Mhm.
is there someone we can reach out to that say, hey, this person submitted their paperwork 2 weeks ago or a week ago? Like, what is the status of it? Because right now I'm looking at her Access HRA and it says it's just like paperwork submitted and we don't know, there's nothing. So what do
Right.
we do in cases like that? Mhm.
So we all know COVID kind of changed a lot of the ways that we interact with each other, right? So even with HRA, not many of the centers are open anymore. A lot of it is done through online. And unfortunately, that's where you get the you can't speak to anyone, right? Everything is done through online. With the My City, the reason why they changed the My City, and you have to create an account in order to apply through My City. Then you can see the status of your applications there. And it's a little bit more like you can check up on it once you have an account. With the My City, they have let us know that it takes approximately 45 days to get a response back if you were approved or denied. And that's 45 business days, not counting weekends or holidays and stuff like that. It used to be less, but it used to be about 11 to 30 days. But with the amount of applications that have come in over the last couple of months, they have said it would be around 45 days before you get a response back. And we don't really have a phone number for them to answer to that they answer. They answer us. It's all through this wonderful app that they now have.
Oh my. So yeah, you used to, I think it was your organization used to assist people who wanted to have the family daycare setting. You helped with them getting their, processing those forms. Do you still do that?
Yes, we do. If you want to become a provider or take like the courses like the CPR first aid, health and safety, and whatever to keep up with your license or to start a new program, you can contact a provider specialist at the Daycare Council. It is the same phone number. You would just, when they pick up the phone, just ask to speak to a provider specialist instead of a childcare specialist. And they also have how to become a provider trainings as well.
Awesome. Are they free?
I don't think all of them are. Some of them are. I
Fantastic.
think how to become a provider is free, but don't quote me on that. But I think it is. I would scream over, but I don't know. And we do have a training catalog that you would be able to see on our website as well. So if you go to Daycare Council, www.daycarecouncil.com.org, you would be able to see the training calendar on there, and it will tell you if it is a fee or if it's not a fee as well.
Thank you.
You're welcome.
Are there any other questions for Jessica?
I have one more.
Okay.
Well, one request, Jessica, can you put that My City link in the chat in the last one that you just mentioned as well, just for everyone, reference? And then my question is there any assistance provided for families in need of these services, but child has like a special need or disability? Like, what does that look like for those parents?
So another great resource for special needs is, hold on, I don't want to say special needs resource because they changed their name, Include NYC. Include NYC, I'm going to also give the phone number to Include NYC. They help with locating any and all services for children with special needs. They're a great resource. We can also look up providers that have certifications to provide services for children with special needs as well. But I would say Include NYC is a great resource. I have used them in the past for myself personally, so I can tell you that they are a great resource. I am going to go ahead and copy and see if I can put this in the chat.
While you're doing that, Jessica, Charlene asked if you could explain the difference between family childcare and group childcare.
So the only difference is the size. So a family, the family childcare is licensed for 6 children, ages 6 weeks to 12 years old, and it's just one provider. So they can have only 2 children under the age of 2. A group family, they're a bigger size, so that means they probably have more room in their home, and they're licensed for 12 children, ages 6 weeks to 12 years old. And it would be them plus an assistant. And so then that allows them to have 4 children under the age of 2. A child is considered an infant until the age of 2 under those guidelines. Did that help out a little bit?
Thank you so
Thank you.
much.
Thank you.
Oh, okay, no problem. I thought I hung up on you guys. I was like, oh,
Can I ask one more question?
Yes, go ahead.
Okay, do you happen to also work with agencies that provide non-traditional hours? Like everyone that we have is like early learn, so the person can't really work because you do have, okay.
Yes.
Thank you.
So when we put in, remember when we have that one-on-one conversation when they usually call, we ask, are Monday through Friday from 8 to 6, are those the hours you need? A lot of the times the parents say, no, I need from like 6 in the morning to 7 at night, or I need something that's for weekends or overnight. When we plug in those hours into the database, it will pull up the providers that work the non-traditional hours.
Thank you.
No problem. I am trying to put in the link before. I'll stay on. I'll put it in the chat if that's okay. If there's no more questions, I'll just plug that into the chat.
Thank you, Jessica. We appreciate you sharing that information.
No problem. Thank you for having me.
You're welcome. I'm going to share my screen so we can introduce our next speakers.
Okay.
Oh, wait. I think I made a mistake. Oh, I don't think this is correct. Hold on 1 second, everyone. That looks like it was from last month. One moment. Okay, yes. Our second speaker is here. Edlin, sorry.
Okay, so our next presenter will be Gabrielle once again, if I mispronounce it, please help me out. Gabrielle Moise from Child Development Support Corporation.
Hi, everyone.
Hi, Gabrielle.
You can hear me?
Yes, we can hear you.
Okay, I don't know what's happening right now. I tried to share, start my video, and then it started glitching.
Okay.
So,
Do you have a presentation to share?
yes, I do.
Okay, I made you co-host.
Okay. Let me see if I can get that together.
Mm-hmm.
Oh. My whole Zoom is freezing right now. Like it's graying out.
Mm-hmm.
Give me 1 second. I'm gonna try to come out and come back in.
Okay, no problem. Okay, Karen, are you on with us? Karen Ortiz?
Yes, I am.
Okay, Karen, would you mind speaking now and then Gabrielle can go after you?
Oh, sure, yeah, no problem.
Okay, let's just switch. Gabrielle, we're gonna give you some more time, okay? If you can hear me. Okay, I'm gonna make you co-host, Gabrielle, and then you can do your presentation, okay?
Me, right, Karen?
Oh, I'm sorry. Yeah. Yes, Karen Ortiz, I'm sorry.
Yeah, no, that's okay.
I don't know what I just said. I'm
No,
sorry.
you're juggling a lot. You're doing great. Thank you. So I'm gonna go ahead and first drop a pre-presentation survey into the chat. And then while folks do that, I'm gonna set up my presentation and share my screen. Just a second. Share screen. Oh, wait.
Hi, everyone.
Hi, Gabrielle. We can see your picture now, but we're gonna have Karen start us off, and then can you present after her? Is that
Yes.
okay? Okay, thank
Yeah.
you.
I don't mind waiting if you want to go for it. Whatever is easier for everybody.
Okay, Gabrielle, do you want to try to share your screen now?
Yes. I
Okay, all right,
can.
let's try. We see a picture, so that's a good sign.
Yeah. So my camera is going to be an issue, so I'm sorry for not coming on camera, but I'm going
It's okay.
to share my screen.
Yep, we can see your
you
screen.
see-
Okay, great. So
Oh,
Karen, we'll have you go after. Sorry about that.
okay. So hi, everyone. I am Gabrielle from Child Development Support Corporation, and I'm here today to tell you about our infant toddler services. So I am an infant toddler mental health consultant at Child Development Support Corporation. I've worked with children, families, and providers for the past 10 years. And my why is I have a passion for mental health. So my team consists of three of us. There's 2 infant toddler mental health consultants and there's 1 specialist. And I'm 1 infant toddler mental health consultant and my colleague Giselle Lord is the other consultant. And then Margot Lawrence is the infant toddler specialist. And the difference between me and Giselle is that I focus on home-based providers. So that's family, group family, and she focuses on centers. Margot, as a specialist, gets to work within the 2 settings. The infant toddler specialist, so I'll kind of break down the difference between the specialist and the mental health consultant. So the specialist provides services to the centers and home base, and it's on-site intensive technical assistance as a quality improvement strategy using standardized tools such as infant toddler environment rating, which is ITERS, and family childcare environment rating, which is FECRS, to assess the needs and measure quality improvement. The technical assistance in childcare include assistance with space classroom arrangements, training for staff, classroom observations, and parent education workshops. So the infant toddler mental health services refers to the well-being of children 0 to 3 years old. As a mental health consultant, I focus on children's emotional and social growth and development. This is done by providing support to adults who care for infants and toddlers. That would typically look like fostering social emotional learning, training on typical development of children, providing problem solving skills, and preventing and managing challenging behaviors. We service all 5 boroughs. My role is to support the caregivers in collaboration to build their experience as early childhood educators. The focus is to address the social emotional development, if there's any challenging behaviors, creating nurturing environment, fostering secure attachment between children and caregivers, and skill building on how to properly respond to various stressors and challenges that may come about in the classroom in a program. And we support the staff through stress, self-care, and burnout. And the reason why I find that these services are important is because as the previous presenter just talked about helping parents find childcare. And when you're leaving your children in the care of these providers, you want to ensure that they're getting the best education as well as the best support, because the things that you instill in the children at a young age is the tools that they're going to take on into their adulthood life. So learning how to manage their emotions, how to deal with conflict, these are the settings where they build their social skills. This is where they learn how to interact amongst others that are not in their household. So being able to support the providers in how they support the children is the key point of these services. As a consultant, I offer guidance, training, and support to childcare providers to help them understand and respond to the needs of infants and toddlers in their care. The process is 12 weeks to build a relationship, have time to do observations. Then through those observations, we set goals based off of what was observed. And we then use what we discussed during the goal setting and start to apply it during that session. And then we do a last assessment to see if there's growth between what I observed, what we worked on, and what were the outcome and the results of that. When it comes to the services that I provide, I allow the providers to know that they're the expert of their environment. So the goals that we come up with will be coming together. It's not me coming in to tell the providers how to run their center or how to run their home. Especially for me personally, I go into the home. So it's not only me, I'm coming to your business, I'm also coming to your home. So just being able to let them know that they're the expert of the environment and that I am just there to support them. Sorry. So with Giselle, she focuses on the centers. So she will go out into the childcare centers and she will support the teachers with necessary skills to support children's social and emotional development through observations and mentoring. We use a tool called Deca. Well, she uses a tool called Deca. I use the tool called IT Child in the programs. And the purpose is just the process is observing and assessing, just spending time in the classroom, observing the interactions and the overall environment to identify any areas where children or teachers may need additional support, providing guidance based on the observations. Will offer tailored strategies to teachers to help them manage challenging behaviors and create nurturing response relationships with the students. So with this observation, we don't come in and just say, okay, hey, I'm here to help. We have to know what we're helping you with. In each center and specifically each classroom may have its own unique needs. So even if we do come into a center and there's multiple classrooms and we worked with one classroom, we are able to support them ongoing. So if we support a classroom, do one classroom for 12 weeks, and then the daycare provider is just like, we need more support. I need you helped classroom 1, now we need you to help in classroom 2. We can Giselle can come in and do that as well to support classroom 2. And that's not within the same 12 weeks. It will start over as like a new contract with that particular classroom. And then we also do trainings and workshops. So if the classroom, if the center as a whole or the staff may need support, we'll come together as a team and we'll conduct trainings and supporting the children and also supporting the staff. The care that we provide is directly to the child care providers. We don't work with the children individually. It is not therapy. So we want to make sure we emphasize that so that no child feels singled out or no parent feels like their child's being singled out if there is challenging behaviors in the classroom. We're focusing on the classroom as a whole, not just one particular child. The individual support that we provide one-on-one support to teachers, helping them address specific concerns they may have about individual children. So if there is a concern there about a specific child, we can support the teacher on how to support that child. We won't directly be the one that's providing services to that child. This can involve developing an intervention plan or simply offering a listening ear and provide professional advice. We collaborate with families. We also work with the teachers to engage with the families, to talk with them about how to present any type of concerns or how to have those type of conversations with the families about any concerns regarding their children. And it's just to make sure that it's a collaborative effort, that everyone has a say in the process. The goal is to create a supportive, healthy environment with both children and teachers so that they can thrive. By working together, we can ensure that young children have the strong emotional foundation they need for future success. So as the benefits of it is the mental health consultant work alongside the providers, and it helps with children show, manage, and talk about their feelings. So if we're starting from infants up until they reach as toddlers, we're showing them how to manage their emotions, how to express themselves, things that are typically common around that age groups is tantrums. They go through that stage of everything is no. They go through that stage of mine, give me, and learning how to navigate that, providing the tools in how to navigate that in a center, giving a fair chance for all children to learn how to express themselves and also validate their feelings. We encourage children to explore their environment. We help reduce with challenging behaviors. When we come in to help and support, we don't have a magic wand to make all the challenging behaviors disappear, but we're there to support them, to find tools to help them and instill things in the teachers so that they can have the tools necessary. So when they see certain behaviors arise, they know how to tackle it and know how to deal with it when it happens. We can't eliminate it, but we can give them the tools on how to support it. We build the social emotional. Social emotional is so important because you see in this day and age how the littlest things tick people off, and it could lead to very bad rage and many unfortunate events that happens. And we believe that if people had this type of support and care on how to manage their emotions, how to navigate their anger, how to deal with these things, it could create a decrease in how these adults navigate the world or how they have a perspective of what the world around them looks like. If they're constantly dealing with a lot of emotional problems from a young age, they have a distortion on how they view the world and how they feel towards conflict, and that can lead to like violent behavior. So if we're tackling it as young as infants and toddlers, we can then make a difference and a ripple effect in how we have functioning adults in society. Let me see. So in conclusion, taking this step, well, this was typically catered to providers, but this is just a matter of just knowing that if you know of any childcare or home-based programs that may need this type of service or may be interested in this service, taking this step will help with having a tuned interaction with the children, not only the parents being in tune, but also the providers that are spending majority of the day with them to be in tune in the children's emotions and knowing how to manage it uniquely, not thinking that the same thing is needed for each child, understanding that each child may have different needs. So knowing how to get down on their level and talk to them the way that they need to be spoken to. It's an increase in building stress management skills because sometimes caring for children can be stressful and overwhelming. So knowing how to regulate yourself when you are feeling their frustration arising or you're getting overwhelmed. So just being able to provide not only the tools for the adults to care for the children, but also providing tools for the adults to care for themselves and take care of themselves, so that when things do get overwhelming, they know, okay, this is a sign that I need to take a step back, go drink some water, to have a breather, count back from 10 before I go address this screaming child right now. It helps with decreasing challenging behaviors and children and adults to have the best social emotional awareness for themselves. And that is the end of my presentation. And I thank you all for listening, and let me know if you have any questions.
Thank you, Gabrielle. Does anyone have questions?
Good afternoon, everyone. My name is Francisco Leopold. I just want to find out from you if it would be possible that I can connect with you to have you come do this presentation at Kings County Hospital, because I'm looking to partner with outside organization. I'm the chair for the CAB at Kings County. And then so we have the different committees and the health and social services. We are I'm looking to partner with organization on the outside. So if it's possible that you could come to do a presentation at Kings County,
Yes,
I would be happy.
my team and I can do a presentation. I will put my email in the chat so that you have access.
I already have it. It's G Moise, right?
Yes.
Okay. CDSCNYC.org.
Yes.
Yeah, so I have Giselle and Miss Lawrence on as well. So I
Yes.
will send an email and see you guys, because if it's okay, then I'll schedule with the public affairs and then they will reach out to you and let you know when. It's going to be on Zoom anyway, so.
Okay. Okay.
Okay, thank you.
Thank you.
Karen, you have a question?
Yes, I'm sorry. Perhaps you said this and I missed it. How is this paid for?
Oh, that was the part that I should have included. It is free and it's voluntary. And no matter how many times you use the service, it's always going to be free. If you're specifically home-based, at the end, the incentive that we give is a gift card.
Any other questions?
I'm sorry, it's me again, Francisca Leopold. So I am planning a mental health forum. So we were supposed to do it this month because this month is mental health, because everything have been very busy and with everything, and it was being held at Downstate because everything we had to move it. So we are still in the phase of putting everything together, all the logistics together and the venue. So it more or less this first part will be get to the older people, but in September we're looking at the youth. So I would like very much if you can be part of that forum as well, if that will be okay with you.
Yes, that would be fine. Thank you for considering me for that. Thank you. I
Yeah, because
appreciate
we are
it.
looking at and I'm very happy that you're already dealing with the children at an early age, because I think many a times person really kind of not focusing on children and think that, you know, all is well, but we don't until it's too late. You know, even when even as they get older and people notice, you know, the different in behavior, they still think that it's just a phase, you know, and they don't really look into it and you know. So I like the fact that you're bringing much awareness early to the babies as they grow up to parents. So, and that's what we are really looking for parents to look at as the children changes, the behavior pattern would change, and they're not thinking that, oh well, they're in the room watching TV or they're just doing that. They have to keep, because I think last year or year before last, we had 11-year-old committed suicide in her room. You know, so I'm very happy with that. So I really look forward for you to be part of the panel.
Thank you. I appreciate that. And I look forward to it as well.
Thank you so much.
Great. Any other questions for Gabrielle?
I have another question. Gabrielle,
Sure.
do you assist? Well, let me just explain the scenario. I have parents that receive IEPs from about their child, don't want to take it. Would it be feasible to have that provider contact you to be the bridge to explain why an IEP is necessary, or that's not something that you would do?
Well, what would happen is that I would have to be working with, depending if it's home-based, and it will be me. If it's a center-based, and it will be Giselle. We would have to already be in contract in order for us to have that conversation with the parent. Because if I'm coming out as an outsider, didn't experience what the provider has experienced, or have had the chance to observe what's going on, I would just be coming in and saying, hey, this is what the provider said, you should listen. But if I'm there working with the provider, or Giselle's working with the provider, they can give their own insight on what's going on and what's taking place and how we're trying to support their child. But we can also encourage that the support can extend to receiving additional services. I hope that answered your question.
Yes, thank you.
No problem.
Okay, if there are no more questions, we're gonna continue with our next presentation. And I have the slide already. Miss Diane, could you present our last speaker? Hold on 1 second. Let me go back and fix it. Okay. Here we go.
Okay. Hi, everyone. I'm Diane Smith. I'm a community ambassador with East Flatbush Community Partnership, and have the honor of introducing you all to Karen Ortiz, MPH, Community Outreach Director with the Bureau of Public Health Clinics. New York City Department of Health and Mental Hygiene. And Karen, I do believe I know you already. Yes.
Yes, we
worked together
do.
before.
We
It's
have.
good. It's good to see you.
It's
Okay.
great to see you.
Okay, Karen, and the mic is yours now.
All right, thank you.
Okay.
I've re-included the pre-presentation survey into the link in the chat. So if folks can go ahead and do that while I navigate sharing my screen. I should be sharing screen now. Can I get a thumbs up if that's working for everyone? Great. Fantastic. All right, so please go ahead and feel free to fill that out. I'm gonna briefly introduce myself and what I'm doing here. My name is Karen Ortiz. My pronouns are she and they, and I am the Director of Community Outreach at the Bureau of Public Health Clinics through the Community Engagement Team at the Department of Health. And before I facilitate today's presentation, I would like to note that the clinic, New York City, sorry about that, that the link in the chat is a survey about some of the contents that we're gonna present that it's gonna cover. Essentially, there are no right or wrong answers to this anonymous survey. It's only 3 questions. And we just wanna, the reason we're asking them is because we wanna be able to tell what you may already know or perceive about the services that we offer, so that we can determine what kinds of services we could do a better job at advertising. Any clarification that we should make about our services, and also just receive feedback about what it has been like for you to engage with us if you already have. So again, it's a totally anonymous survey. So if you would like to be contacted about your feedback or have something you want follow up on, you're welcome to put your contact information in one of the answers, but that's not required. However, if you don't do that, then there's no way that we can follow up with you because it's anonymous. And just to note that after this very brief presentation, we will be asking you almost the same questions again, just to make sure that this slide deck as a tool is appropriately filling in any of those potential gaps that may be in your awareness of our services. And so also to say it's meant to be a way to, you know, keep our finger on the pulse of what stakeholder feedback is and how to make programmatic improvements. So please feel free to go ahead and answer those 3 questions while I conduct the presentation. Again, no wrong or right answers, just to see if it's effective in filling in the gaps. So I'll go ahead and start. One thing to know is that I'm part of the community engagement unit and for the clinics and not a clinician. And so this presentation is going to be a conversation about our services and not really medical processes, but more sharing a bird's eye view of our offerings. So if you have questions about like medical procedures or the science behind our work or data, we can definitely have a follow-up separately to invite one of our doctors or statisticians to come and share that information. All right, so can I see some thumbs up if folks are finished with the 3-question survey and I can continue? Or do we need another minute? Okay, cool. All right, looks like folks are ready. So I'm gonna go on and start the presentation. So as a brief introduction, the Bureau of Public Health Clinics, or BPHC, essentially oversees the sexual health clinics, the tuberculosis chest centers, immunization clinics, and the COVID Express testing clinics run by the city's Department of Health. As I go along, also feel free to ask questions, unmute, or put it in the chat and I'll circle back. Here is our mission and vision of the agency, which is just to provide services that help New Yorkers make their own informed choices and some empowered health decisions, and just be a part of the options to care that is accessible and contributes to healthier communities. All right. Here we see this pie chart of just the 4 different major programs that make up the public health clinics and provide a very high-level overview of the types of direct clinical services offered at the clinics, and noting that the sexual health clinics includes STI and HIV testing and treatment, vaccinations, and contraceptive and reproductive care. Okay, so starting with our sexual health clinics, here we see a brief presentation, a brief description of the STI services. Of the sexually transmitted infection services, we offer medical evaluations for signs and symptoms of STIs And for people without symptoms, we can also receive more routine STI testing for chlamydia, gonorrhea, and syphilis through our express clinics. Of our Mpox, formerly known as monkeypox services, we also offer testing and treatment as well as vaccination for Mpox, Hep A and B, meningitis, and HPV. We also offer conduct urgent follow-ups to patients contacted by clinic staff. And I will put some things in the chat actually so that folks can have kind of a brief summary of each of the slides. What is that chat? That one? Whoops. How do I access the chat?
What do you need to do?
Oh, I was just gonna put, oh, here it is. Sorry. Yeah, just a little summary of my slides into the chat in case folks wanted to circle back.
Okay.
But I'll go on to my next slide now. Yes, so sorry about it being cut off here. Of our contraceptive services, we offer emergency contraception, sometimes known as Plan B or the morning after pill. And we also offer non-hormonal as well as hormonal intrauterine devices known as IUDs. Another form of long-acting reversible contraceptive or LARC is the implant. And these are the only methods we offer by appointment only. All others, such as the quarterly shot, the monthly ring, the weekly patch, daily pills, these are all available on a first come, first served walk-in basis. So we do provide folks with pregnancy tests and options counseling by our trained social workers for those that would like to be connected to the full range of options available to them in New York, including our most recent service of medication abortion. And so medication abortion or abortion pills are for people that are in their first trimester of pregnancy and is now available at the Jamaica, Queens, Morrisania, Bronx, Central Harlem, Manhattan sexual health clinics. And folks can call the telemedicine hotline for medical evaluation, counseling, and clinic appointments. And walk-ins are also accepted. The last walk-in for medication abortion service ends at 2 p.m. So I'll put that little summary there also in the chat. On to our continued services. We also, of our HIV services, we offer HIV post-exposure prophylactic, so PEP, HIV treatment initiation for people diagnosed with HIV who would like to start HIV treatment for the first time, medical evaluation for people who think they have signs of or symptoms of HIV, or for people who might have been exposed or have been exposed to HIV. People without symptoms, of course, can also receive HIV testing. And we also offer PrEP initiation and counseling. We also understand that for many of our patients, there are intersecting issues or reasons that brought them to our doors. And for others, they may be receiving news about their health that might bring up some thoughts or feelings. And so to better serve them in a more holistic way, we also offer behavioral health services. And we have licensed social workers on site that provide a number of counseling services, including various crisis counseling services, substance use screening, and connection to long-term behavioral health support. I'll put that in there real quick. Then moving on to more expanded sexual health clinic services, we also have express clinics, which we affectionately call our quickie clinics or quickie labs, express labs. And those are for people that want to get tested recurringly and they're not experiencing symptoms or require further evaluation by a provider. So these are often folks that just want to be tested regularly and anticipate wanting to be tested every X amount of time, just as their personal practice. And so our Chelsea and Fort Greene clinics, express clinics offer appointments for these express testing services. Our usual services are all walk-in, but the express ones you're in and out in 12 minutes, so we book them that way. These sites offer testing for HIV, chlamydia, gonorrhea, and syphilis for people that have no symptoms of an STI. HIV test results are provided on site, and chlamydia and gonorrhea test results are usually available within just a few hours. While this service is different than most of our clinic services because it does take appointments, we do take walk-ins if we happen to have the capacity. And so I'll share the link for that in the chat as well. Alternatively, for even faster service, you can also speak to a New York City healthcare provider for telemedicine services related to the medical management of a positive or abnormal STI result, a HIV treatment initiation for those diagnosed with HIV who would like to start treatment for the first time, consultation for PrEP initiation, including PrEP and PrEP on demand, medical evaluation for those who think they might have signs or symptoms or that have been exposed to HIV, emergency contraception, to make appointments for IUDs and the implant, for medication abortion services, and any related services, any related medical evaluation, counseling, and other clinic appointments. So I'll put the number for the telemedicine services in the chat as well. Okay. All right, so here is our sexual health clinic map and operating hours. This is where our clinics are. We have our Chelsea and Central Harlem clinics in Manhattan. We had a third one that's still currently closed in Riverside. We have our Jamaica and Corona clinics in Queens. Our Morrisania clinic in the Bronx is the only one we have in the Bronx. And our Fort Greene clinic in Brooklyn is the only one we have open in Brooklyn. We used to have a Crown Heights one, but it's sadly still closed until further notice. Of our remaining clinics, we're able to provide services between 8:30 a.m. and 3:30 p.m. from Monday through Friday. When the clinic is busy, priority is given to patients coming to the sexual health clinics for emergency services. So like PEP, emergency contraception, HIV treatment initiation, and urgent follow-up for patients contacted by the clinic staff. And then after visiting the clinic, you can get your test results online with our patient portal. And all clinics also may close early on certain days once capacity is reached. So I'll leave that link in the chat there here. Next, we're going to pivot a little bit to an infographic that shows the TB rates by neighborhood, with the dark blue areas having the highest concentration of tuberculosis with an above citywide rate. And so as you can see, the top three areas include Sunset Park, Western Queens, and Flushing, Queens, with annual rates per 100,000 people. So we also connect people to tuberculosis services, and I'll put the link to that in the chat as well. And so in order to respond to this need, another, I guess, branch within our Bureau of Public Health Clinics is the Tuberculosis Chest Center services. And so anyone at risk for TB can get a free evaluation and treatment at a chest center. The health department chest centers provide low to no cost testing, treatment, and care for tuberculosis. We do not ask about immigration status, and you do not need health insurance. Tuberculosis services are confidential, and the clinic services include TB testing by skin test or QFT blood test, the chest x-ray, medical evaluation for TB, treatment for active TB disease or TB infection, the sputum induction, social services by referral, and also directly observed therapy either in person or by video conference. Now, as far as testing eligibility, you can be tested for TB if you have risk factors for developing TB, including exposure to someone with infectious TB disease. But chest centers do not offer TB testing for like work or school purposes. You must have an appointment to be seen, which is different than our sexual health clinics. And you would have to call the center that you want to visit to make an appointment. So here's a little summary of that tab. And I apologize that it's a little overlapped here. So unfortunately, our Washington Heights Chest Center remains closed at this time, but we do have the Corona, Queens, Fort Greene, Brooklyn, and Morrisania, Bronx Chest Centers co-located with our sexual health clinics. And they are open Monday through Friday, 9 to 5. The TB Trust Centers provide several services during one visit, so you may spend a little more time than you would at a typical medical appointment, but all the TB related care, including the blood work, the sputum collection, the x-ray and medication, is provided at the center on the day of your visit at no cost to you. The Trust Centers do not routinely provide test results via phone, email, or text. In most situations, patients are required to return to the clinic to get results and information about next steps needed to complete their evaluation. You do not need to have health insurance to be seen at a Trust Center. All eligible persons will receive services, and the health department will not collect any payments or co-pays from you. However, it is important to distinguish that a little bit different from our sexual and reproductive health services, the health department is required by law to bill health insurance companies for TB services if someone does have insurance, which is different for sexual health services. You don't have to use your insurance if you don't want to use your insurance, and the service would still be provided. So if you do have insurance at TB clinics, then the health department will bill your insurance plan first. So here's a little information on that. And now we're going to pivot again to our immunization clinics, which is the third clinic of the 4. And the Bureau of Public Health clinics can offer required school and college vaccinations at our immunization clinics. And so you can get your seasonal flu vaccine and other recommended vaccines at this clinic. You can get low or no cost immunizations at the health department's Fort Greene Health Center immunization clinic. It's the only immunization clinic we have is the Fort Greene one, regardless of your immigration status or capacity to pay. Just be sure to bring your vaccination record if you have it, insurance information if you have it to the clinic, and the Fort Greene immunization clinic will provide immunizations recommended for children 4 years and older, teens and adults, including the flu vaccine, the DTaP and Tdap or the TD vaccines, hepatitis A and B, the HPV vaccines, the inactivated polio vaccine for children through age 17, the measles, mumps, rubella vaccine, the meningococcal vaccine, pneumococcal vaccine, the varicella vaccine for children, and also the Hib vaccine for children age 4. Which is a little bit longer of a recap, but oh no, let me break it up into 2 pieces. Here are the vaccines for young folks, and then here are the vaccines for adults. Nope, that's wrong. So we don't offer travel vaccines, and we don't offer the shingles vaccine, which is a question we often get. All right, now onto the COVID-19 express testing clinics. We actually have updated this. We now only have the Crown Heights one. It used to be 4. So we do still have the Morrisania, the free COVID-19 test at the health department's COVID Express site at Crown Heights. And this is available by appointment. Test results are available within 24 hours of the visit. The clinic will contact patients who test positive, and expanded services to offer testing for respiratory viruses like the flu or RSV are also available at the Crown Heights Clinic. So there is the site there for folks that want more information. Now I have more specific information about each of the clinics. Since this is a Brooklyn meeting, I will skip the specific slides for, oh, I think it's, yeah. Let me stop sharing for 1 second and unhide that slide. Hmm. Okay. Screen again. There we go. And so I want to provide a little bit more in-depth information about our Fort Greene sexual health clinic located that also has the immunization clinic and the TB clinic. And so it's located at 295 Flatbush Ave Extension, and it's unique in that this is the one clinic that has that's open late on Tuesdays until 7 p.m. And these express clinics offer testing for HIV, chlamydia, gonorrhea, and syphilis for people with no symptoms. And this clinic is also unique because it has all of the clinics within the Bureau of Public Health clinic, so that it's including the TB test centers, immunization, and the sexual health clinic. And so I'll provide a summary of the hours and its availability within the chat as well. And yeah. Okay. And then accessing the public health clinics. To recap, if you do want to use your health insurance plan for your visit to any of our clinics, then your insurance plan will be billed. But if you do not have health insurance or do not want your health insurance to be billed for, you will be asked to pay a sliding scale fee based on your family size and yearly income. It is also important to note that you won't be asked for proof of your family size or yearly income. And so no payments are collected at the clinic. And you can see the links in the chat that I provided for additional details. But we really want to emphasize that if you do not have health insurance or cannot pay the fee, you really can still receive the services. You're entitled to them, and we will provide them for you. All right, and so that's the end. Thank you so much for your time. I'm going to go ahead and pop in the post survey, just because we really want you to provide that feedback of, thoughts about the presentation or thoughts about the information that was provided. I definitely do not take it personally if you have feelings about the locations or hours or things like that. We just want to get your honest feedback. And so I'll go ahead and put our post survey in the chat, so you can go ahead and do that. And then in the interim, I will take any questions. I see Rhonda has a question.
Good afternoon, everyone. We're having somewhat of an issue getting our children, our New Yorkers, immunized. Couldn't get it out. So we were wondering, is the clinic available for a Saturday for our parents to come in for our New Yorkers? Because when they get that letter from the school stating that their child needs immunization, they tend to keep them home during all that time.
Yeah. Rhonda, I would love for you to give that feedback in the survey. This is something, and I know all the other folks here know that whether you work for the city or not, this is something that the staff has shared, and that we definitely feel, we feel a lot for those community members that have a hard time reaching our services because of the hours, and we're not open on the weekends. And what we need to do is provide enough concrete feedback from our community stakeholders who have a valuable voice to show more than just anecdotal evidence of that there is a need for this, for an expansion of the hours and expansion of the days, so that more people can get either tested or vaccines or, screenings or whatever it is that folks are looking to get addressed. But I absolutely agree with you.
Okay, I'm putting it in the,
Yeah, please do.
I am. Okay, thank you.
Are there any other questions?
Good question. Do you know how you decide where to put the sensors? Like, is there data on why you put them there? And I don't know why the other ones are still closed.
Yeah, so about the location of the health centers, those locations, most of them have been there for a really long time. So like decades ago. I'm not really sure about that. That's a good question. If folks have thoughts or feelings about the locations, that's also something great to put into the not to be too activisty, but like that's also something that we share about our accessibility to specific communities. I believe our Chelsea and Fort Greene locations are our busiest locations because they are pretty close to transportation hubs, and a lot of people work in either Manhattan or in downtown Brooklyn. Those are kind of like work hubs. So for some folks, it's a little bit central. And then other times, those decisions are made kind of well above my my level of way back in the day. And then as for like the closures of the other clinics, we've not been able to secure staffing and or funding to reopen the clinics after the COVID closures.
I already closed off, Ms. Ortiz, I already closed off my, my survey. But one other thing I would like to suggest is a bus.
Okay, I think that the survey actually you can go in a few times, but what about a bus? Like something that will commute people?
The screening buses. Maybe
Oh,
can go
I
around
see.
into the school,
A
especially
mobile unit.
yeah, where they're New Yorkers have been impacted in that community. Like our community has received a lot of young people and families from Haiti, Central America, so from Venezuela, from parts of Africa and the Arab nations. So, I mean, if a bus can come to the school on a Pacific day and give out immunization, I think, or utilize a school building for that, I think that would be for our students. Because when they get that, when parents get that letter, they do not send their children to school, and that impacts their attendance record.
Yeah, absolutely. That is fantastic feedback. Thank you.
We have a few more questions. I think Sebastian had a question.
Yes, thank you. I'm Sebastian Williams, here in Brooklyn at the Brooklyn Community Recovery Center, Bed-Stuy, Crown Heights. I want to know, how can we support your programs and initiatives to help strengthen connections? I heard you say that the Crown Heights facility has been closed down. How can we strengthen and support your initiative with our connections here?
I think any forums or opportunities that you have to give feedback to echo the needs of your community. If you know that the Crown Heights neighborhood, I mean, I live in Brooklyn. The closest clinic to me would have been the Crown Heights if I were a person that was looking for these services, for any of these services. And yeah, it's closed. So any opportunities that you have to give that feedback, such as through this survey, I think that would be really welcomed. Yeah, I'm trying. I'm not sure what other evidence they're looking for, but you know, I'm collecting it.
Is it possible?
Sebastian, were you offering to somehow maybe partner to have the services located at your location? That's what I thought you were alluding to. Am I wrong?
Yes, that's what I have in mind.
Yeah.
As far as is it possible that one of your representatives can one day join our meetings here and help raise awareness in this community, because it's a dire need, being that the facility in Crown Heights is closed down. I don't know the statistics about the HIV and certain STD population that may be infected, but I'm quite sure that there is some numbers out there that we can look into the data and bring more awareness. We do have an HIV program here every week connected on Zoom, and members, we share and spread awareness about STDs and HIV awareness. So I think if it's possible that we can link up and one of your representatives can join us one day on Zoom, and we can have more of dialogue in that space to see how we can support each other and spreading awareness to our community here since the clinic in Crown Heights is shut down.
Yeah, I mean, I'd be happy to present this very presentation. I just put my information again in the chat just in case any of you want. I'd be happy to do this presentation at your sites, either in person or virtually, so that we can get a few more voices from the community saying, you know, that what Brooklyn needs. I do know the data. It's not great. It's not great. And we're very fortunate to be aware of the resources because we have these kinds of opportunities for sharing, for resource sharing, but the average community member is not always aware of what is available.
Just one more part of it. I don't want to be too long-winded. I'm really adamant about how social media is having an impact and influence on the young minds of our people. When they post different things, they take their appearance as if they are living this life, and most of them are chasing the material. And it seems like if you watch these gold digger prank videos, that they're willing to do anything, even sleep with the man, long as he has money. But we need to raise awareness to our young minds and make them aware that you don't have to sell your soul for $1 just because this man has money. He could be transferring disease to you too, at the same time that he's giving you this money. And I think if we can tap into, I mean, it's a big machine that we're fighting against when we talk about social media, because they control the minds of our young minds of our children. So that's what we're up against. I'm not sure if you're in the same vein as what I'm saying. We have to tap into this people through social media and fight against the social media engine. It's billions of dollars invested in TikTok, Instagram, Facebook, and those are the platforms that control the minds of our children. And we got to fight each step to bring them back to reality. So I think if we can have more of a dialogue and create a space for that, we can develop a presentation and some programs to reach through that platform to reach our people a little bit better. What do you think?
Yeah, we do have a youth serving unit within the health department. It's not my specific unit, but I know that they do have something of a social media presence. The health department has a separate social media handle for all of the different platforms, whether that's Instagram or there's always I'm not actually, I don't know all of them, but there's a bunch of them. And they do put in some messaging there, but yeah, that's definitely something that our comms team could take into consideration. And if you do follow them on any of those platforms, they do check them and people do leave comments or even message them directly. So you could even leave that feedback like, hey, I noticed that this content is for adults. Do you have any plans to offer more content for youth? Or hey, are you on other platforms that the younger folks are using, like TikTok or whatever the other ones are? You know, posing those questions. As staff, you know, we have a lot of thoughts about how to improve the work that we do, right? And I'm sure within our respective workplaces, many of us feel the same way. And I also think that there is more that is owed to community members and there's more, almost in some ways, this is not like the perfect way of expressing it, but maybe more credibility when community members are speaking or repeating the things that we have said, like, hey, we think that we should do this, because, you know, then it's coming directly from the place of need, rather than like, oh, I have this creative idea about what I think we should do at work, right?
Mm-hmm.
So this is all really good feedback, and there are definitely some actionable items there for folks.
Can I just add one more thing before I silence myself, because I'm sorry, I really don't want to be long-winded. It seems like we can always open up platforms to get people air, but how can we keep their air? And I think there needs to be some type of initiative, incentives to keep them coming, because if you look at the reality of survival, people will love to get on these platforms and have open dialogue and discussion about raising awareness and protecting themselves. But if we look at the reality about survival when it comes to paying their bills, have to pay their rent, or buying groceries, and they just don't have the time to log on to these platforms because they have to work. And in order for them to get away from their 9 to 5 for a couple of hours, how can we find that balance? What kind of initiative can we, or incentive can we offer them to stay away, to step away from their employment for about an hour and then come to these platforms to get stuff that's really important, dire information that can help them? Because if we're talking about survival, a lot of people just don't have time to get on these platforms when they're trying to survive and pay their bills. So it's hard to keep engaged.
Yeah, no, I 100% agree with you. I think this is why the health department has so many different wings to try to attack things from so many different angles, because when you do look at the barrier to a person being holistically healthy, there's so many different things. Like I'm talking about TB, STIs, immunization, and COVID, but there's people that, you know, need housing, that need food, that have food insecurity, that have like all sorts of other things. These are all competing priorities. And not everyone has a job that's going to let them step away for an hour or two. That's going to be like, yeah, sure, go and like do this thing and learn about your community. I mean, honestly, sometimes I don't have that and I work for the health department, right? Like I can't step away from my to-do list sometimes to learn more about some of the things that would be beneficial for resource sharing. So that's why I appreciate spaces like this and these comments, because it does take all of us. It's going to take all of us and more than all of us for to get the message out and to each put in from our respective angles of work.
Thank you for letting me share your time and your space and representing the Phoenix South Brooklyn Recovery Center. And I will be reaching out to you so we can think about a way that we can strengthen partnerships and communication and collaboration. Okay, thank you.
Yeah, absolutely. Please do. And that invitation is open for anyone. If you would like to collaborate on outreach in the neighborhoods our clinics are in, or if you would like to make connections with any of our partners, you know, the health department is so big, we'd be happy to connect with you. If there are other professionals within your networks at your respective workplaces or other places of resource sharing, we'd also be happy to provide these presentations at other sites or virtually or in person.
Thank you so much. Does anyone have any further questions for Ms. Ortiz?
I do. Hi, Ms. Ortiz. So at this point, I'm a little bit confused. The development of the public health clinics was for what purpose? Because it sounds like I know, let's say Metropolitan Hospital in the city, they have a clinic that you can go in that could offer all of those things. You did mention right now in speaking to the gentleman that you're trying to approach problems from different angles so it can be solved. But now I'm really confused as to what I used to use them way back in the day to get my contraception. It was fabulous, right? So I'm just trying to understand the purpose of the public health clinics as opposed to, let's say, the health and hospital, you know, clinics or things like that. What is the difference? Like who should we send for what?
Yeah, sure. That's a great question. So it often depends on a lot of things. Some of our partners, including health and hospitals or other partners, are funded to reach only specific populations, or folks need to have certain, you know, demographics or things within a catchment area or within a different funding streams want different things to make sure that the work stays funded. And something that the government doesn't have is that I mean, we definitely do have to respond as to like where the work is happening and like who's doing it and what's the purpose and what are the outcomes. We do record all of that. But we have a little bit more leeway in terms of like, we're actually not turning people away, right? Some folks might be like, oh, this program is just for youth, or this is just for people in Brooklyn, or this is just for citizens, or this is just for, a lot of programs will have different funding streams. And we have a lot more flexibility with that. You can be a person receiving services from another state sometimes, depending on the service. You can be a person that has or doesn't have insurance, that if you can't pay for it, we still provide the services, and some people will be like, you're just going to have this bill and you're going to figure out how you're going to do it or how you're going to pay for it. Yeah. And so like our clinics don't have necessarily all of the barriers to entry that other clinics do. And even if we were all providing the same day, it's always nice to give folks options that are in different locations, that have different hours, that have different kinds of, you know, things to offer, because the need is great. And so the more folks that can provide services, the better. Honestly, wait times are pretty low, especially at our express clinics. And one of the big barriers to entry for care for a lot of folks is that they don't want to spend all day at health and hospitals, right? Like you go in for something and you're there for several hours, even if you have an appointment. And so by making it a walk-in clinic that doesn't take appointments for most of the services, or that you can just come in and like get everything you need within the one visit, it just adds to the options to care. So just people have more options.
Awesome. Thank you.
Yeah, thank you for your question.
Okay, thank you, everyone. Thank you so much, Karen. We're going to transition and we have a few minutes for our program updates. So this is the opportunity for any of you all to just share what's going on in your world, in your organization, if you have any upcoming events. And I'm just encouraged today that there were a lot of conversations around partners collaborating. So this is the time to share out. Feel free to unmute yourself and you can share whatever announcements you have.
Hey everybody, this is Natasha and Steva from the East Flatbush Family Enrichment Center. This was a great meeting, got some awesome information and a lot of contact information. So feel free to take mines out the chat as well. Again, my name is Natasha Steva. We have an event coming up for the community members of East Flatbush. We have registration. They can check out our Facebook page or our Instagram page. It's a paint and harvest. It's a paint and sip happening at the Sesame Flyers Clubhouse on Church Avenue, and that will be June 6th. So feel free to come out, register. Children are also welcome, free food, and you'll be able to leave with your awesome paintings after you paint and harvest.
Thank you, Natasha. Anyone else?
Hey guys, it's Keisha Sidney here, Community Outreach for Sesame Flyers. Just wanted to let you guys know we are having our annual sports day on June 1st at Old Boys High. That is, I believe it's 77 Rutland Avenue between I think Albany. The flyer, I know the flyer has been posted in the newsletter in East Flatbush Community Partnership newsletter, and we also have it on our it's Eventbrite. If you can register your kids, you can go up on Eventbrite and pull it up. I would share the link with Lamika so she can put it in the email to share it out to you guys if you want to register the kids. We are asking for everybody that's attending to register because we will have food and stuff like that. So we want to just make sure that we're catering for everyone. The kids that will be attending, they will be getting t-shirts. So definitely, they definitely need to register. I'm going to try to see if I can put the link in the chat here before we get off.
Thank you, Keisha. Karen, would you like to share?
Yeah, two things. One is we will be hosting a Budding Careers in Cannabis workshop on June 25th at 11 a.m. Just pinpoint the date. I'll send more information about that. And also to highlight that the Section 8 applications are coming out in early June. I'm sure most of our customers have been waiting a long time for that. So be on the lookout for that.
Thank you, Sebastian.
Yes, thank you. I just wanted to share with the group some of the services that the Brooklyn Recovery Center here in Brooklyn Phoenix House provide to our community. For anyone that's in this community that you know that need resources in getting coaching for certified peer recovery coaches, certified peer support specialists that coach with mental health struggles and substance abuse struggles, we have services here that they can walk in. They don't need an appointment. They can just walk in. We're located at 20 New York Brooklyn, right across the street from the Restoration Center. I will put a link of our website. It's in the chat. Also, we do give out free food and clothing every day when our doors open. If you know someone that's hungry, they can just walk by our facility, knock on our door, and tell us that they're hungry, and we'll walk in the back and we'll get them some food, and they can go into our clothing donation room and pick out the clothes that they want. We also do Narcan training. So if anyone is in need to understand the dangers of fentanyl and how severe it is in our community, you know, it only takes 3 grains of salt. If you touch it, you can go into cardiac arrest and die. So we are very strong on providing that information, on spreading awareness about the safety of fentanyl and the dangers of fentanyl, and we provide that Narcan training so we can come to you, to your location, to your staff, your school, your church, wherever you are, and we can come and give your staff Narcan training. From Monday through Friday, Monday through Saturday, we have various programs, everything from self-healing, meditation, yoga, HIV awareness, the biopic affirmation, garden. We have a garden club. We have a professional peer development workshop and wellness. We provide a lot of information in this community. We're right across the street from the Restoration Plaza. Again, that's 20 New York, and all are welcome. And we would love to collaborate with anyone in this community to help spread awareness and provide these resources to anyone that's in need. So remember that we do SERPA support. We have SERPAs here on staff. I'm a SERPA myself, a certified peer recovery coach, a life coach, and a certified peer support specialist. And they can just walk in and we'll sit down and talk with them and get them connected to the resources that they need in their community. They need help with their resume, GED. We have access to get on the computers. They can get on the computers and do research and have anything they want. We have a lot of resources in this community. So thank you for giving me the opportunity to share that. And hopefully some of you guys will reach out. We can collaborate to provide more resources for our community to help strengthen the power of New York and Brooklyn. Thank you.
Thank you, Rhonda.
Good afternoon, everyone. My name is Rhonda Watson. I am the Community School Director here at Walt Whitman Middle School. Next Thursday evening at 5:30 p.m., we will be having our annual community forum here at the school. All are invited to come out and find out our vision and get other resources and information from our vendors. I'm also seeking vendors as well as facilitators for workshops for that evening. So if you are interested, I'm going to put the flyer in the chat, and you can reach out to me and let me know if you would like to be a vendor or a service provider that evening. Thank you so much. Everyone have a great night.
Hi,
Rhonda,
Rhonda.
which day is that event again?
It's May 30th. It starts at 5:30 p.m. and it's here at Walt Whitman Middle School, 72 Veronica Place, between Albemarle Road and Snyder Avenue.
Okay, thank you so much. Mr. Brown?
Hey, good afternoon, everyone. Great energy in the space, great information. I just wanted to extend the invitation that if there are any community groups out there, family led, peer led, community led groups out there that are looking for space, you know, to have meetings, to come together, you know, and, you know, do whatever might be, you know, part of that agenda as it supports the community. Please reach out to me because we have some available times and space on our calendar on Tuesday evenings between the hours of 6 and 8 p.m. Typically the last 3 Tuesdays of the month. So if there's a group out there that's, you know, challenged with obtaining space to come together and conduct their affairs, certainly reach out to us, and you know, we are open to having that conversation and see how we might be able to support that here at the 20 New York Avenue Brooklyn Community Recovery Center. Thank you.
Thank you. Charlene?
Hi, Good afternoon, everyone. I'm Charlene Gordon from the New York City Department of Health. And I placed in the chat my contact information if you wanted to reach out to me. And I also placed in the chat a link to our webinar schedule for this month and next month. So please share it. But I also wanted to bring to your attention that we're having a home visiting forum. It is basically for any agency that does home visiting, that your staff does going to the home, do a home assessment of that family's home. We having a webinar that will talk about the different environmental hazards, and we do have a checklist, and we wanted to share out with you so that you could hopefully take that information and share with your families. So it's free. It's going to be in June 13th from 10 to 12:30, and it's virtual. Okay. And it's great if you could register or have someone within your agency register if you do home visiting. Thank you.
Thank you. Do we have any other program updates? We have room for one more.
Just wanted to add that I did put the link in the chat for anybody who wants to register their kids to come to the sports day.
Great. Thank you so much, everyone. Just want to remind you that our next meeting in June is going to be held hybrid. It's going to be at our location, 57 Willoughby Street. And for those of you who are unable to attend, we will have a Zoom segment as well. But we definitely encourage you to come out in person so that we can see your wonderful faces in person. We love to do that. Alrighty, everyone. So thank you so much. We have about just 2 more minutes. I'm just going to leave the Zoom open for a few. If there's any other conversations that you want to have with people who are still here in the meeting, but we are officially done with today's monthly meeting. Thank you so much, everyone.
Does Mr. Thaddeus Brown have his contact information somewhere regarding as it relates to the space?
I do, and it's further up on the chat tree. I'm getting ready to drop it in again.